For many years we've been investigating the problem of pain assessment in dementia, in severe dementia, where people with dementia have difficulty telling others they have pain, because you can't measure pain in the same way as you measure blood pressure or temperature. We rely on the patient, but in severe dementia, people cannot tell us that they have pain. Pain problems are missed, and we even hear stories from nursing staff of serious issues like fractures or abscessed teeth going undetected for days, sometimes longer. An implication of that is that when pain problems are missed in dementia, we see patients display responsive behaviors that are sometimes difficult for the staff as well as for them. And these behaviors are often misattributed to psychiatric causes. So these patients are treated with psychotropic rather than analgesic medications. And these psychotropic medications in this frail elderly population hasten death. So we have methods of assessing pain in this population based on nonverbal pain behaviors. But oftentimes, staff in long-term care facilities tell us that they have very limited resources and very limited time. And they're not always in a position, they're not usually in a position to be able to assess every patient as frequently as necessary. So to overcome this problem, we have started to work with a group of computer scientists, biomedical engineers from the University of Toronto and Toronto Rehab. And we started work toward an automated system to detect pain behaviors. When it's fully developed, this will work as patients go about their daily routines, and then the system will notify the nurses, who could then go and check on the patient and intervene. That creates the tantalizing possibility of potentially being able to have patients assessed for pain 24 hours a day, something that no human assessor can do.
We brought the automated system into long-term care homes, and we tested it on residents with dementia and also those that have like a condition that results in pain. And what we did was, for the purposes of the study, we had the resident sit in front of the camera for sessions up to half an hour. The nurse would be trained on how to use the system, how to respond to the system. And what we did was we evaluated how often the nurses would come and check on the residents in the long-term care home. And prior to this, we also did some surveys and questionnaires with the nursing staff to see what was their readiness to incorporate this new technology, not only like from themselves, but like from the facility point of view as well. They have the appropriate resources to implement the technology. And then we also did interviews with the staff, co-residents, family members as well, just to get a better understanding of the long-term care home, just because each home is a little bit different, and we wanted to make sure that we can mold the intervention so that it would be successful in that particular home. And we did this project across 4 homes, and we had about 30 participants. And then we also did post interviews as well, just to get kind of a sense of, from the nurse's perspective, what are some of the things that they liked, things that they didn't like, that we could change in the future, just because we want to make sure that with this type of technology, if we were to implement it in long-term care, that it would be not only like sustainable, but also like meaningful and help with the nurses and the care that they provide. Find that with patient partners, either family members or staff, they're so knowledgeable in this particular environment. Although we do research in the environment, we're not there day to day. We don't have kind of like the ins and outs of how a long-term care home actually runs. So it's always so valuable having someone like that as part of our team and letting us know, like, this might not be feasible. Maybe we should look at it from a different perspective. So I've always valued having the opinions of patient partners involved in our projects. Mary, what she's been really valuable in contributing to is letting us know from a dissemination standpoint, like how can we word this so that it's helpful for caregivers. She really knows kind of like the ins and outs and gave us some really valuable suggestions on how we can better disseminate the information either via posters or more like a huddle style with the staff, things like that.
One of the things when this became something common in the Canadian health research enterprise to have patient partners, a lot of scientists were quite skeptical. But it was remarkable to discover the types of contributions that patient partners can make. I just couldn't believe it. In fact, I can't imagine working on a project like this without them. I had a student who was collecting data on a project, and similar projects that we had done in the past, the data collection took about 1.5 years. Well, our patient partner became involved in that project, and she took the word out there. She wrote to her people, to different organizations. That data collection was completed in 3 months as compared to 1.5 years, which would have been what we expected. She was tremendously helpful with dissemination. She contributed to papers. She came to conferences with us. As Vivian mentioned, played a key role in knowledge mobilization material. We did a big social media campaign at some point about pain and dementia, patient partners, 3 of them.
With this new technology, once it's been like fully implemented, I think that'll really help the nurses and the other care staff being able to detect pain earlier so that pain is more manageable for not only the staff, but for the residents as well, because once their pain has gotten to a certain level, it's more difficult for them to manage the pain. Also reduce any uncertainty that staff might have about whether or not a resident is in pain, and just overall improving the quality of life of residents in long-term care so that all residents have equal opportunity to care regardless of their cognitive abilities.
In fact, through a series of studies, we have demonstrated that when pain is assessed frequently, quality of life improves, pain levels reduce, the quality of interventions improves, and perhaps unexpectedly, nursing staff feel less stressed on the job. We monitor staff stress in a control condition, and in fact, we showed that nurse stress over time reduces when they assess pain frequently, because that has tremendous implications for the quality of interaction between staff and patients. So, to the extent that the system results in more frequent assessments, we'd expect to see the same types of benefits.